So I next call Dr. Monalisa. She's there and she'll be speaking upon a comparative study of external DCR and endonasal DCR in Eastern India at a tertiary eye care center.
So good afternoon. So my topic is a comparative study of external DCR and endonasal DCR in a tertiary eye care center of Eastern India. So nasal lacrimal duct obstruction is one of the commonest cause of epiphora, and DCR is the treatment of choice for NLDO, and it can be done by either external or endonasal approach. In our study, we tried to compare the external DCR and the endonasal DCR. So it was a hospital-based randomized prospective comparative study, and we included the patients of age more than 18 years and patients with primary NLDO and functional NLDO, and we excluded the failed DCR patients and the NLDO due to any trauma or tumor or any multiple etiologies. And patient with the chronic dacryocystitis underwent surgeries in two categories, in which group A was in external DCR group and group B in endonasal DCR. All the ophthalmic examinations were carried out and patients were followed up on day 1, then 1 week, and then 1 month, 3 months, and 6 months. And success was defined as the patency of the NLD and the symptomatic improvement. So we saw the results in, as in you see in table 1 in terms of demography. The parameters in form of age, gender, and the symptoms and duration were comparable in both the groups. And in the table 2, you are seeing the intraoperative factors in which the group B has significantly higher surgical time than group A, and complications were higher in group B. And in post-operative factors, the success rate was more in group A than group B. Then the success rate of external DCR and endonasal DCR are comparable, and the studies in the published literature was showing the range from 90%, 80% to 95%. However, in our study, the success rate was 95.2% in group A and 85% in group B. The rates of intraoperative and the postoperative complications are comparable between the two procedures. So according to Karim et al., they reported there was no difference in complication between the two groups, and the Jha et al. Showed the less intraoperative hemorrhage in endonasal DCR group than in the external DCR. In our study, the intraoperative complications in the form of nasal mucosal injuries were more in the endonasal DCR group. However, the limitation was the small sample size and the surgeon experience in the endonasal DCR. So coming to the conclusion, the group A had a comparatively better yet statistically insignificant success rate than group B. Endoscopic endonasal DCR has a learning curve for beginner ophthalmologist and takes more surgical time. Cosmesis with regard to the postoperative skin scar was better for the endonasal DCR group. The external DCR, however, remains the time-tested surgery with the higher success rate for chronic dacryocystitis. Thank you, ma'am.
New in this?
Um,
So it's already established fact, right?
Yes, sir. Actually, this study first thing is carried in Eastern in India Eye Care Center, which was not carried before. And second thing, we tried to see the surgeon was established in external DCR, but she was just started beginner in the endonasal DCR group. So we tried to show the difference between the beginning surgeon and the established.
So what do you recommend? If the case comes, do you hand over to ENT surgeon or you will do?
Sir, actually,
both are equal in their significantness, no insignificant. Or you want to get yourself trained into endonasal DCR?
Yes, sir. The surgeon was beginner, so that's why difference was more between the two group actually.
Okay, you are equally confused after the study also. Okay,
Sir. Thank you, sir.
Doesn't make the difference of the study because every surgery needs some learning curve there. But what is your recommendation that external DCR should be done or endoscopic DCR? Because there is established, there are so many studies already there in the study. What is your experience? Your means you did the surgeries?
Yes, sir.
So what is your experience about the failed endoscopic DCR? That is again repetition done or external DCR done?
Sir, the failed endonasal DCR were converted into the external DCR on table, sir.
On table.
Yes, sir.